All right, we will go ahead and get started just for the interest of time and making sure that we have time to get to everybody's questions. Thank you again for joining. Welcome to the second webinar of the Summer Transition Series. We are here to talk about health and wellness, get all of your questions answered about the upcoming semester. I do want to preface this webinar by saying, I know that a lot of you have a lot of pressing questions. They're probably the same question that faculty and staff and current students have as well. So while I hope that today is going to be helpful in providing insight into what the fall 2021 might look like, or just getting your questions answered, please know that everything is subject to change as public health recommendations are updated, and as Duke's team kind of monitors the COVID-19 pandemic and all of its after effects. So we'll probably say that like a billion times, that everything is fluid and plans are constantly changing and being updated, but hopefully this will give you some semblance of baseline answers for all of your questions. So again, thanks for joining. My name is Casey. I work in new student programs. I'll be moderating the session today and kind of being your guide throughout this webinar. How it'll work, so down at the bottom of your Zoom screen, there is a Q&A box with little two chat bubbles. You can go ahead and click on that and start typing in your questions. I'll ask them aloud to our panelists, who we'll introduce in a second, and we will run through your questions that way. If you happen to submit questions ahead of time, I also have that pulled up, so I'll be able to get those questions answered as well. I want to take a quick moment to introduce the panelists. So if you could share a little bit about you, your area, and what you can kind of provide, what your role as far as like health and wellness has been. Yeah, and we'll start. I'm going to start with Chris. I'll popcorn it to you, and then if you could popcorn it to the other panelists, that would be great.
Great. Hi, good afternoon. My name is Chris Roby. I'm the Assistant Vice President for Student Affairs. My day job is working with a department called University Center Activities and Events, and also our Strategic Communications team within the Division of Student Affairs. And really my role, I guess, on this panel is to let you know sort of what we're doing this summer. I'm also working with Joe Gonzalez to sort of manage the day-to-day when it comes to COVID response and sort of all the elements associated with that, and really think about and listen to what your questions are, so that as we start working on our websites and make sure we have our FAQs in place, that we're listening to what you're saying and making sure we're addressing them once we get the information to share. And I'll pass it to Laura.
Hi, everyone. Welcome. My name is Laura Andrews. I'm the Associate Dean of Students, and in non-COVID times, I'm working as a non-clinical case manager in the Duke Student Wellness Center. But for our COVID year, I've actually been managing our contact tracing protocol, and so that's one of our tools in our toolbox in terms of helping prevent the spread of COVID on campus. And if you're not familiar with contact tracing is when we interview someone who has COVID, and we talk to them about what they've been up to, who they've been in contact with, and then we make sure that those students are cared for, supported, and then also any students that might have been exposed, we let them know about their exposure and make sure they have access to resources too. So that's what I've been doing for the last year. Thanks, and I'm going to send it over to Kellen.
Yes, my name is Kellen Beecham, and I am the insurance manager here at Duke University, based in Student Wellness Building, and I handle all things insurance. So if you have any questions, be sure to ask, and I'll pass it on to Crystal.
Hey everyone, my name is Crystal and I'm the nurse manager at Student Health. My role, generally speaking, in non-COVID times is to assist with all the things at Student Health and keep them efficient and safe. In the COVID times, we have initiated the COVID nurse line for students that's open 8 to 8, 7 days a week, symptomatic testing and daily touch points with students in quarantine for symptoms, quarantine for exposure, or students that have tested positive for COVID. Right now, we're working on swabbing, getting, hold on, I'm sorry, I'm all like jimble jabble. We're working on COVID vaccines for students to be able to administer those at student health, to test symptomatic students at student health instead of at offsite locations, and some other things. And I will pass it over to Jordan.
Hi, everybody. My name is Jordan Hale. I work in new student programs here at Duke. I just do what Casey tells me to do. And so I am here to be a support and also to answer any of your broad questions and see how orientation can be a helpful part in your process of getting started here and to support our colleagues. So thank you for joining us. And we have some questions coming in. So this is exciting. So we're excited to get those answered as best we can.
Awesome. Thank you for the introductions. We have 2 questions in the chat. We also have a handful of questions that people submitted ahead of time. So let's go ahead and get rolling. The first question is, how will general health insurance work? What options are there and where can we see this information?
Okay. Yeah, this is Kellen Beecham, insurance manager. So the insurance open enrollment begins June 15th. So all students will receive an email with questions, I guess guidance, I should say, on how to enroll or waive the student insurance plan. So if you have a current insurance plan that meets the waiver requirement, you can actually just go to your Duke Hub and complete the waiver, and you should see the insurance charge removed. If you want to enroll, same process, you just click enroll. Go ahead, that policy will take effect August 1st. And if you're an international student with an F1 or J1 visa, you are automatically enrolled into the student insurance plan. When you go to Duke Hub and follow the steps, it's just going to let you know that you have already been enrolled and no further action is required. So if you do hold an F1 or J1 visa, you are required to enroll into the student health insurance plan.
And kind of a follow-up question to that is, so if someone chooses to decline the student healthcare plan offered by Duke, so if they had their own health insurance, how would they go about doing that?
Yeah, so the instructions will be in the email that goes out on June 15th. It's basically, you go to your Duke Hub, you click on, I can't think of the tab, but there's a tab in there, and it'll ask you, would you like to enroll or would you like to waive the student health insurance plan? If you choose to waive, it's going to ask you 6 questions, and based on the way you answer them, you'll get an automatic waiver, and then you'll get an email follow-up, typically within 24 hours, saying, hey, congratulations, your insurance plan has met the waiver requirement, and you will see the insurance charge removed from your Bursar's account.
Awesome. Crystal, did you have something to add? Okay. The next question is, what are mental health resources like at Duke and how accessible are they?
I'm happy to take this one. I work in the Student Wellness Center, and so we have a counseling and psychological services, and students can receive services regardless of whether or not they have the Duke Student Health Insurance. So they can walk into that resource for both counseling and psychiatry, or they can schedule an appointment. They also have a referral coordinator within CAPS who can help connect students to resources for support in the community, should they choose to maybe go to a provider in the community that takes their insurance. So there's lots of opportunities for mental health support at Duke. We also have a lot of student groups that are interested in mental health at Duke, and so sometimes I know students will connect with those groups as well.
It looks like the next few questions in the chat are about the upcoming June 15th deadline. So if you are not aware, please be aware that immunization forms are due and have to be submitted to student health by June 15th. There are a few questions, so I want to make sure that I'm getting all of them kind of asked in this. So the deadline for immunizations is June 15th. Do they have to have all of their vaccinations by that June 15th deadline? Are they able to, there are a few people who have said like they have their TB scheduled after that, their second dose of COVID after that. So So are they able to submit their updated vaccination records after the 15th?
So I'll answer that. June 15th is a soft deadline, we'll say. Asking majority of students to submit their immunization information to us by June 15th gives student health staff an opportunity to have it processed by August. So when students are arriving on campus, we know where everyone stands. We know what vaccines we need to administer. We have supplies and vaccines on hand, and we can help you get compliant, hopefully before the first day of class. So June 15 is, I would say, a soft deadline because student health staff are not able to process everyone's incoming records in the month of August alone. So that's the answer to that question.
Is there a hard deadline? Like, does everyone have to have it by the time that they move in?
Well, this year is a little different, being that COVID vaccine is required. So I think the information that's going to get pushed out about COVID vaccine is specifically the COVID vaccine needs to be completed before the first day of class. Of course, there's exceptions to every rule. There are going to be some students who have not received their second dose before the first day of class or something along those lines for various reasons. So we will work with each student on an individual basis to help them get as vaccinated as possible before the first day of class. The second deadline we're looking at is the state of North Carolina immunization compliance deadline, and that is 30 days after the first day of class. So the absolute hard deadline is September 22nd. If you are not vaccinated or don't have a good reason why you're not, you will be removed from class September 22nd if vaccines are not, if the vaccine requirements are not met and the tuberculosis requirements not met. Now, if you're working with student health and you're partially compliant, or you're waiting on a result for a lab or something like that, we understand that. We'll have you on our radar as working on it. The only folks we would press to move from class would be someone who has submitted nothing, or has not communicated with us at all, or is not cooperating.
There's a
Okay.
question specifically regarding international students. So as an international student who needs to get vaccinated after arriving to Duke, what are the first steps for me to get vaccinated once I get to Durham?
So we will hold, student health will hold vaccine clinics in August, in the first week of September, and then the week of the 20th of September. And of course, more of those could pop up as needs arise, but we have those three dates on the schedule to assist any student that's coming in that needs vaccines. We understand there are some people who aren't able to get everything they need before they come. So I would say look for information coming from your program about what days you can come to Penn Pavilion to get vaccinated.
Thank you. Crystal, I think I have one more for you right now. Let me find it again. Okay, so again, asking for international students. Do unvaccinated international students have to quarantine before moving into their dorm?
The answer to that is no.
All right, let me hop back into the Q&A because we've had a few pop up. I guess a follow-up to the June 15th deadline. Which would be preferred, sending everything that they have right now and then updating as stuff comes in, like vaccines and tests come in, or would you rather people wait and then submit everything at once?
In terms of if we're just talking about COVID, if you are waiting on getting your COVID vaccine number 2, wait to give us your COVID information until you have both doses. If you're referring to your tetanus, MMRs, varicellas, hepatitis, etc., if you have almost everything and you have no Tdap and you can't get a Tdap, or your next dose isn't due for 3 months or something like that, submit to us what you have. But if there's a long gap in when what you have and when it's due, then submit it now. If you're just waiting 1 more week for something, then just wait and then send it to us once it's completed. But definitely in terms of COVID, is send that to us once you have both doses completed.
Great, thank you for that clarification. There's a question in regards to an insurance waiver. I know out-of-state HMOs are not waived. However, my state of Georgia HMO is an open access HMO. If I verified that there are facilities in Durham that are in network, will my insurance be considered?
Yes, if your HMO is an open access HMO or open access POS, a point of service plan, it will meet the Duke requirements. When you contact your insurance company, just verify that Duke Healthcare is in network for routine medical services, not for emergency room or urgent care, because every insurance, a US-based insurance plan, there's no out-of-network emergency room or urgent care. So you have to specifically ask if your insurance plan covers you at Duke for routine medical care. And if the answer is yes, then it does meet the, it will meet the waiver requirement. That just means Duke Health System is considered in network. And if you have an HMO, also call your insurance company and let them know that you will be a full-time student. And if they offer some type of coverage while you're at school. And typically you just have to give your first day of class sometime in August and your last date of class sometime in May, and your insurance will provide a letter for you. And you can just submit that letter to us, just showing proof that, yes, it's an HMO based on whatever state you're in, but because you're a full-time college student, they will cover you while, you're still active at school.
Great, thank you. I've got another one for you. I'm a DKU student attending Duke in the fall, but also an American citizen. Would the waiver process for insurance be the same for me?
DKU students, we have you covered. I am in contact with your program coordinators every day, just about. So I already have your roster. I know when you're going to be here. And it's, if you're going to be here for a specific amount of time, maybe 6 or 8 months, we're going to prorate all that. We will take care of everything with DKU. So DKU students, you're taken care of. Still complete the waiver. If you're domestic, just go ahead and complete the waiver, but we'll take it from there. And if you're DKU domestic, you meet the waiver requirement, the insurance charge will be removed. You will come off the roster that DKU is providing. So we have a policy, we have a process in place, I should say, to make sure you do not get charged for that insurance, but still complete the waiver process if you're a domestic DKU student.
Awesome, thank you. Just as a reminder, feel free to keep adding questions to the Q&A. I know we have a few in the hopper, but just wanted to plug that. Crystal, you may have touched on this a little bit, but I just want to make sure for the person who submitted this question that they get the answer that they need. So if a student is coming to Duke and missing some of the required vaccinations, are they required to get them done through Duke? Are they allowed to get them locally in Durham if they schedule that themselves? What does that process kind of look like?
Hey, that's a good question. So yes, students are able to get vaccines from basically anywhere. So if you have a primary care office in Durham or whatever, CVS Minute Clinic, if you wanted to run by there and grab a Tdap real quick and a gallon of milk, just doing some shopping. But Yes, it does not have to be at student health by student health. So long as you get the vaccine that we've asked you to get based on your state requirements, you submit it to us, we process it. That's beautiful. If you want to get it through student health, we'll be happy to help you. But if you wanted to get it before we're starting our events for incoming students, that's also perfectly fine.
And there was a question tied to that. So does that still count if they are like, what am I trying to ask? Like if they are traveling and come to Durham and then get it in Durham, so like right after, like right before move in, is that still applicable? And if they do decide to get it through Duke, is that like, is there a fee associated with that?
Oh, I see. Okay, the first part of your question was, yes, they can get it before move-in, just so long as they get it and submit it to us, we process it. So if you had an appointment or have an appointment, say, to come on August 17th to get your Tdap, and then you end up getting it at CVS on August 5th because that's what that came available and you did it, then that's fine. You don't have to come see us on August 17th unless you need something else that you couldn't get at CVS. Then you would need to come see us. How it's billed, is that the next question? So generally, all immunizations except for flu and COVID are billed to insurance. So we would bill your insurance for varicella, hepatitis, tetanus, MMR, polio, any of those, we will bill to insurance. For the COVID and flu, those are covered by the health fee. And this is not an immunization, but it's still in this category for the tuberculosis screening. Anybody that needs a T-spot or an IGRA, that is $80. You have to pay for that up front. So we've been billing those to the bursar, and then we'll give you some information on how you can submit that to your insurance for a claim, and they will reimburse you most of the time about 80%, but each policy is different. So I make no promises on how much you get reimbursed, but we'll give you the information to submit it to your insurance for the claim.
Casey, I just want to piggyback on Crystal and the T-spot. So the student health insurance plan, primarily for international students, when they get the T-spot, they do get a 80% reimbursement. Actually, it's 100% now. So they changed it going into new benefit year. So you will get charged the $80. It will show up on your bursar's account. And then what we'll do is we give you a form, a pre-printed form. You just have to complete the demographic part, so the name and the address, and then submit that to Blue Cross and Blue Shield for reimbursement. So I say this to say, for international students, please, 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 when you arrive to the States and you get your domestic US address, please update your Duke Hub account, because that's the information that I will actually send over to Blue Cross and Blue Shield. So if you have your home country's address, Blue Cross, they do not send mailings international. They do not do international mailings. So if that address is still on file, when you're submitting a claim, and that's the address that's coming from me to Blue Cross as an international address, then you're going to have a default address, which is going to be student health. And we get about 2,000 reimbursement checks and we do our best to try to, distribute them accordingly. But, that's typically around November, December, and everyone's leaving campus. There's a lot of things going on. So please, as soon as you get your domestic address, your campus address, wherever you're going to live at, please update Duke Hub and list that as your mailing address, because that's the information I send over to Blue Cross, and that's where your check is going to be sent, your reimbursement checks. So we definitely want you to get your money.
Everyone wants you to get your money.
Definitely.
We have a couple more questions. Is there co-participation for vaccines with the Duke Student Health Plan? And if so, how much is that?
As far as vaccines, the vaccines, the bills are submitted to the Student Health Insurance Plan, and they're going to be covered. The T-spot is T-spot and flu are 100%. So
We've had a question come up in multiple spaces. So for someone who gets their vaccines here in Durham, I'm assuming that the questions are referring specifically to the COVID-19 vaccine. Is there a sequester period required after receiving the vaccine in Durham?
No, there's no sequester period for any vaccine. More information will be coming out, I think, as we get closer to the fall start dates. But the students are not required to sequester. No.
Next question is, where do we check if our immunizations have been confirmed by Duke?
All right, so I'll do my best to walk through verbally how this happens. First thing I would say is go to the student health webpage. So that is studentaffairs.duke.edu/student health. Once you're on the student health homepage, on the left-hand side, there is a tab that says immunization compliance. You'll want to click on that tab. And
I can walk it or like share my screen if that would be helpful.
I mean, it may be helpful since this is recorded and people might watch it later.
Okay, let me share it real quick. And I just searched Duke Student Health, and this is the first
Yeah.
one that came up? Mhm.
Absolutely. So if you just scroll down and you'll see immunization compliance there, click that. And then if you scroll down a little bit more, number 5 under the, keep going.
Oh.
Number 5 under these mandatory steps, it does say, oh, just kidding. It's step 4, not step 5. Ha! Look, I'm glad you're doing this because I'm gonna confuse everyone. See where it says Student Health Gateway? This, you can literally click on those words, the red or orange Student Health Gateway, or that I don't think you can technically
let me
log
get
in
it.
as a student, but the students can log in there. That Student Health Gateway is where we're asking you to update your immunizations. Then you email us your record and we will process it. Once we've processed it, we're going to send you a message in the gateway that your records have been processed, and it could be one of various messages. Either, hey, we've received everything and you're good to go, or we've received what you sent and you're missing these things. And we will describe in detail what you're missing. But going to the gateway, that is the way that you communicate with us and we communicate with you regarding immunizations.
Awesome. I'm not sure if someone in this group can answer this, but I'm going to ask it anyways. Is there a separate fee for access to Duke's gym, or is that included in general health / recreation fees?
So the health fee and the rec fee are combined. So if you see a health fee billed to your account, the rec fee is added on to that automatically. I mean, it may be a different show as a different charge, but they kind of, are kind of together as one. So if you happen to want to waive your health fee for whatever reason and you meet the requirements, you're waiving the rec fee, and you probably won't be able to get anywhere on campus as far as to work out to the gym or anything. So.
Good question. Next question is, what are the brands of COVID vaccines available at Duke for the second dose? What if you don't have the same brand I took as a first dose? So if you want to kind of talk through that sequencing, Crystal.
Sure. So at this very moment, Student Health doesn't have any COVID vaccines. Duke Health is the keeper of the COVID vaccines. The primary brand that Duke Health has is Pfizer, but there is also Moderna or Johnson & Johnson available in Durham and with Duke Health. If you have dose 1 at home and it's not one of those 3 brands, well, actually 2, because Johnson & Johnson is a single dose. So if your dose 1 is not Moderna or Pfizer, then you should not get it if your second dose is due before you need to come, because I can't give you a dose that I don't have, or you stay home until you get both doses. That would be the suggestion, is either stay put, get both doses, and then come to Durham, or don't begin the series if you can't complete it, if it's not a Moderna or a Pfizer.
And if they come without anything, they can get their first and their second dose taken care of here.
Yes,
Okay.
yes, if we're, well, yes, that's the best answer. Yes, if they have nothing, we will help them get vaccinated. Our goal is to have vaccines, so student health staff will be administering it, but that's not a live action plan at this second, but that's our goal. So either student health or someone within Duke Health they'll be able to get it through Duke Health. Alternatively, if they wanted to go to Walgreens or CVS or an external source, but in Durham, that is available too. It does not have to be administered through Student Health or Duke Health.
Great, thank you. Okay, so there's a question in the Q&A, and it's a little bit lengthy, but bear with me. And panelists, feel free to reference it if you forget part of what I asked. But this is what it says. If I'm not able to get the COVID-19 vaccine and the other immunizations, for instance, Tdap, MMR, et cetera, and I'm waiting to arrive at Duke to be vaccinated, can I get all of them by the hard deadline? So that September, 30 days after classes start that you mentioned earlier. Meaning potentially getting 5 shots within a time frame of 4 to 6 weeks, or would that be considered partially compliant while we wait to get the different shots even after the 30 days North Carolina hard deadline?
So that is a question that can't fully be answered unless I'm looking at your immunization record, because that's person specific. But broadly speaking, yes. So most of the vaccines, if someone needs multiple vaccines, most of them can be given on the same day. When you're talking about a vaccine that has a series of 2 or 3 doses, you're considered partially compliant while you're waiting for the due date to come for dose 2 or dose 3. You would be non-compliant, for example, if you receive dose 1 of your COVID vaccine and your second varicella and your second hepatitis B, if you received all of those things together, but there was something that you didn't get, and for like, say you needed 5 shots and you were like, I can only do 3 today because I just need more time, or for some reason you only did 3, you would be non-compliant until you got those other 2. But there's no spacing required, so there wouldn't be any reason why you couldn't say, come see us the next week and get the other 2, and then you'll be fine. So it depends on where you're at with how many doses in the series and all the things like that. But if you're considered partially compliant, we will not remove you from class, because we know that you're waiting for the next due date to come before we can give you the next vaccine. So we don't count that against you. We know you're partial, and that keeps you in good standing. Did I answer all of the question?
I think so, yeah.
Okay, good.
Let me see. Let me see if you have any other questions, feel free to drop them into the Q&A box. Let me double check the survey to make sure that I got everyone who submitted questions ahead of time. While I'm doing that, do we have any update about, I don't want to open a can of worms, but do we have an update about what fall testing will look like, or like entry testing, or like, is there any information that we can share about that? I know that's like the big question that everyone wants to know. And probably like the stickiest question to answer.
Do you want me to answer that question, or Joe or Chris, are you gonna pipe in?
It's just there's so much that's really in process right now. What we're hearing is we'll know more at the end of June. So I really don't have like anything that is concrete to offer. I wish I did. I think we all do. It is the question of the month for sure. One thing I would say is stay tuned and look. There's a website called Keep Learning. Keep an eye on that website for updates and information as well. But as things progress, we will definitely be sharing.
Okay, so we had a question come up. Can you explain the information about the recreation and health fee that you talked about earlier? And Kellen, I think, correct me if I'm wrong. I was looking at the explanation of fees on the Bursar's website. And I think the health fee is separate from the insurance, like health insurance, which you can waive the health insurance, but I believe the health fee is a mandatory fee that students cannot get out of because it supports the health of the community.
Correct. I can clarify, Casey, for you. Yeah.
That would be great. Yeah.
Yeah. So let me bail you out of that one. Yeah. So the health fee and the student health insurance are two separate fees. The health fee allows students to be treated as student health at no additional cost, except for, I think there are some labs that we may send outside. That means that the full processing of those labs cannot be done within student health. We have to send them to a third party. Those are subject, that's the only thing that's going to be subject to your health insurance. But a regular typical visit, if you just have, your arm hurts or whatever, you come to student health, there's no additional cost, there's no copay. That's what the health fee covers, along with nutrition and caps. So that's the health fee. So when I was speaking of waiving the health fee, that does not happen on a regular basis. It's specifically for typically graduate programs that, let's say, are pretty much 100% online or 99% online, because there's some of them that have to report for 1 or 2 weeks and they go. So those programs, and then undergrads, sometimes we have an undergrad program or two that may be in a dual program, meaning they have classes on our campus and maybe like at UNC or something. But those programs are few and far between, but those are the ones that are typically eligible for the health fee waiver. So it gets confusing to the students sometimes, because they may, for example, take a class at UNC, let's say the fall semester, and they'll try to come to Duke's campus to work out. And it's like, well, you're at UNC. So I don't want to go too deep, but typically, no, you're not going to be able to waive a health fee if you're newly matriculating student. So you're going to pay the health fee for that one. But I was kind of, given an overall, but I don't want to confuse anyone. So let's just focus on, no, you're not going to be able to most likely waive the health fee. Okay.
So you should be good.
Yes.
Use the gyms. Use the gyms. Use your services.
Use it. Yeah. You're paying for it. Use it. Yeah.
Laura mentioned in the chat, and I just wanted to bring some awareness to it. She made a good point that counseling and psychological services, CAPS, within student wellness is not, you don't have to have the student, like the Duke student health insurance, in order to utilize that service. That is covered within the student health fee. So yeah, just wanted to point that out because Laura mentioned that in the chat. Let's see. Another question that we have is about allergy shots. When will allergy shots resume at Duke?
So the plan for allergy shots is that they will resume in the fall. I don't have the exact schedule and plan intact yet. I have a meeting set up next week with the medical director to get that sorted out. But the big answer is yes, they will be resuming in the fall. Exactly what the schedule will look like, I don't know that yet. Stay tuned and look at the student health website, specifically the allergy section, a little bit later in July. As soon as I have a concrete schedule and plan in place, I will update the website and it will be there for you to see exactly how to submit to us your record, and your orders and your things that need submitted before you come.
Awesome. All right, we have about 13 minutes left. If you have any pressing questions, be sure to put them in the Q&A box. I want to make sure that you are leaving here with no question unanswered. Real quick, Laura, I know you mentioned working in the Student Wellness Center. There is a lot of things that make up the Student Wellness Center. If you would like to shamelessly plug any of them, I would love if you could talk a little bit about health and wellness resources outside of like COVID vaccines that exist for students.
Sure, yeah, I'd be happy to do that. So we have a great student wellness center that opened in 2017 on our campus, and it houses many resources. We've got our counseling and psychological services there, student health, physical therapy, there's dental, there's Duke Reach, which is the office that I work in, and that's non-clinical case management. So if there are students that are experiencing any kind of obstacles, even before you come to Duke and you're worried about how you might navigate them, you are welcome to reach out to our office and we can go ahead and start proactively reaching out to support resources for you and making those connections. In fact, over the years, I've seen that students have been doing that even more proactively, which we think is really fantastic. So definitely feel free to reach out to Duke Reach if you need anything. And then we also have Do Well, which is our programming unit. So you'll see lots of really cool activities that they program in partnership with students about uh, different moments of mindfulness that happen every week. So there are opportunities for connection with each other and doing really fun things like Tai Chi and knitting and tea ceremonies. So there's lots of really good resources on the website. I linked in the chat here that takes you straight to the CAPS site. But if you kind of go to the top, you'll be able to see all the other resources that exist in the Wellness Center. And if I forgot anybody, let me know. I know we have nutrition that's with student health as well.
All right. Looks like we have about 2 more questions left. So the first one is, will the other immunizations, flu shot, MMR, et cetera, be fully covered by the SMIP?
Yes, the flu vaccines are covered by the health insurance, the student health insurance plan. If you do not have if you're not going to enroll or you meet the waiver requirement for the, to waive the student plan, you have to contact your private insurance to see how they would cover that. But I don't even think we even submit a bill for that. You just come in, we get your scheduled appointment, and we give the flu vaccine, or we'll have I guess what they call flu fighters, Crystal, that go around to different locations. That'll be posted later on in the semester where the students can go and just get the flu vaccine. So we don't even bill for that. So I wouldn't stress about being billed for the flu vaccine.
All right, this is a really good question. In my head, I went, ooh, as soon as it popped up. But and I feel like this is a question everyone can give their own little spin on. But from your experience, what is one healthy habit you wish that every Duke student had?
I'll start it. I think, like, to ask a question, just ask if you have questions. Don't feel like you're on an island by yourself and no one wants to help you, because you're not going to know a lot of things. Everything's going to be, you get a lot of things thrown at you at one time. Don't be afraid to ask. And especially when you're in student health, if you feel something is wrong, say something's wrong. Don't be ashamed to talk with our providers, speak with our providers.
I'll chime in with something. I think, get some sleep. I think everybody comes to college and rest is, can be sometimes difficult to find, but I think the ability to get some sleep is severely overrated. So you certainly want to spend time with your friends and build those bonds, but doing everything you can to get 7 to 8 hours of sleep a night will make those bonds easier to build and make you have a more quality college experience. So mine would be getting some sleep.
Yeah, I would say take advantage of some of the really amazing sort of contemplative spaces on campus. One behind the Wellness Center is great. Going to Duke Gardens is amazing, and the National Museum. I mean, now that we're coming out of COVID, there's so many great places just to reflect and relax and just kind of catch your breath.
I think these are all really great things. I might also add, don't be shy to reach out to the people that you meet from the very beginning of your journey here at Duke. Like I think that your facts will be very helpful to you. Your academic advisor will be like the point person that you get to know right away. And if you have a question, like as Kellen said, if you have a question, the odds are everyone else is wondering the same thing too. So it's definitely worth asking and connecting with and building relationships with the people that you're meeting.
I was going to say sleep, but Jordan stole that. So I'll just chime in with wash your hands and stay hydrated. But while we're laughing about that, it for real is important to wash your hands, because we do see a lot at student health when things are spreading around campus. It for real just spreads, and it's hand washing is the one way to prevent it. And examples of things I'm talking about is pink eye or like a GI bug. It's on the door handles, and everybody has to use the door handle to get into the door if it's a common door to your dorm building or the classroom or whatever. So when the doors are just dirty, so you have to keep your hands washed or sanitized, because we do see things that are not high risk, or what am I trying to say? They're not necessarily a big deal, but they can impact you and cause you to miss class, such as pink eye, for like temporarily for one day, or something like that. You can't go. So it's not a big deal, but it is a simple thing that we can do. So
I laughed when you said that, because for the last 15 months, Jordan has been signing off every email with "Stay safe, wash your hands, Jordan." Like every single email, it's "Hey Casey, have you seen this? Wash your hands, Jordan." So I laughed. So it's a simple reminder, but it's a good one. I think the only thing that I would add as far as healthy habits and advice, I mean, Duke Duke is a highly selective institution, right? Like you all know that coming in. I feel like there is sometimes this pressure to go, 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 and be the best and do the best all the time. And realistically, like that's not a maintainable standard. It's not always sustainable for your own health and well-being. And so I would say be easy on yourself, and like as much as you like, obviously please pay attention to academics and like do what you're supposed to do when you're here, but also like take time to enjoy Durham and Duke and a bunch of the other like fun things that are happening on campus, because sometimes it's really easy to burn yourself out and then you get sick, versus like if you take little breaks you're able to like thinking of it from like a preventative healthcare kind of mindset. So absolutely work hard, like do your best, but it's okay to be easy on yourself and to enjoy the little things, because in the long run it's going to make you sleep more, it's going to make you a happier person. So I would add that. But think we are out of time and we are out of questions, which is a beautiful thing to happen at the same time. First off, I just want to thank all of the panelists. Like, thank you so much for spending time with us and answering questions. Just as a reminder, this session was recorded, so we will be posting it on it's Duke University New Student Programs YouTube channel. I'll also be sending out a copy of this in the weekly digest email that goes out every Tuesday, so you'll receive this. Kellen, you're raising your hand. If there are any like last minute thoughts from the panelists, let's go around and kind of do that. I will let Kellen kick us off.
Thank you, Casey. I appreciate that. Just a couple of quick takeaways. When all students, especially international students, please update your address, your domestic address as soon as you know it. And the students that do have an HMO, again, with those like a Blue Cross Blue Shield HMO of whatever state, reach out to your insurance and ask for a guest membership. That's what it's called, a guest membership while you're a full-time student. And then just provide that letter so we can go ahead and waive your insurance plan, so that way you're not paying for dual coverage. And then you can email us with any questions. Email us at insurance@studentaffairs.duke.edu, and you can also give us a call at 919-684-1000.
Any other parting words from our panelists?
Just see you all in the fall. Thank you for coming. And if you have any questions, and thanks to the people who jumped on this panel, a lot of the faces on this panel have helped keep this university open for the last 15 months. So our team is incredibly appreciative of you all and your work and spending some time here with us. So thank you and great job, Casey.
Yes, absolutely. Big kudos to them. I am going to shamelessly plug the rest of the series. So obviously we've had the campus resources. This is the health and wellness webinar at the beginning of July. So July 6th, starting the 6th, we have advising and registration webinars. So meeting with the academic deans and advisors for Trinity on the 6th, Pratt on the 7th, and pre-health on the 8th of July. And then later, July 21st, we'll have a peer connections webinar. So we're gonna round up some student leaders so you can have a peer-to-peer conversation that will be way more informal. It likely will not be a webinar. That way they can see all of your beautiful faces and you can have conversations back and forth. So we'll have first year advisory counselors, those are our orientation leaders, transfer advisory counselors, and then some international house orientation peers. And then we'll also have the Pratt E-team and the Trinity peer success leaders. So be sure to check that out for a conversation with them. And then August 4th, we'll have a Welcome to Duke. That will be a webinar hosted by New Student Programs. We'll also invite International House and Housing and Residence Life just to talk through the logistics of you're almost here. What does move-in look like? What to expect during Prios and orientation week and all of that good stuff. So just want to plug these. We'll continue to put them in the digest and also post them on your Facebook page as well. So awesome. Thank you for joining and we will see you next time.